Welcome to Module 2. Today, we're diving into a skill that's at the very heart of patient care. Literally, we're talking about assessing a pulse. Now, this is so much more than just counting beats. It's a vital sign that tells you a story about what's going on inside your patient's body. Getting this right, it's absolutely critical. So let's get started.
Okay, first things first, what is a pulse? Well, every single time the heart gives a good squeeze, a contraction, it forces a wave of blood into the arteries. And that wave, that little expansion you feel, that's the pulse. It's a direct physical signal from the heart. And believe me, that simple beat tells a huge story. It's a real-time update on how well the heart is working and whether enough oxygen-rich blood is actually getting to all the tissues. Think of it as a crucial piece of the puzzle you're solving for every patient. Now, when you take a pulse, you're not just getting a number. You're actually assessing 3 different things all at once: the rate, the rhythm, and the strength. Each one gives you a totally different insight. First up is the rate. You know, how fast or slow it is. And you've got to know that what's normal for an adult is way different for a child or a baby. An adult's resting rate is usually somewhere between 60 and 100, but for an infant, a rate of 160 could be totally fine. So knowing these age ranges isn't just helpful, it's essential.
Next, you've got to feel the rhythm. Is it steady and predictable? Kind of like a metronome. Or does it feel off? You know, like there are skipped beats or extra ones thrown in there. An irregular rhythm, even if the rate is normal, is a big deal and something you have to report.
And finally, there's the strength. Is it a really strong, pounding pulse that's pushing hard against your fingers? Or is it faint, weak, and hard to find, what we call thready? A thready pulse is a serious red flag. It means the body isn't getting good blood flow, and that needs immediate attention.
All right, so we know what we're looking for. Now let's get into the how. We're going to nail down the technique for measuring both a radial and an apical pulse.
So the place you'll check a pulse most often is the radial artery. It's right there on the wrist, on the same side as the thumb. For most routine checks, this is your go-to spot. Super easy to find.
The technique itself is simple, but you have to be precise. Use the pads of your first 2 fingers, and whatever you do, never use your thumb. Your own thumb has a pulse, and you'll end up counting that instead. Use gentle pressure. Now, if the rhythm is nice and steady, you can count for 30 seconds and just multiply by 2. But, and this is a big but, if it feels irregular at all, you have to count for a full 60 seconds. No shortcuts.
But what if that radial pulse just isn't cutting it? Maybe it's really weak, or it's irregular, or maybe your patient is on certain heart medications. In those cases, you need to go straight to the source for the most accurate count, and that means taking an apical pulse. And to do that, you're going to need your stethoscope. A quick but super important note on infection control. You always clean the earpieces and the diaphragm with an alcohol wipe, both before and after you use it on a patient. This step is completely non-negotiable. Okay, so you've cleaned your gear. Now you'll find the right spot on the chest, right over the apex of the heart. You're going to listen for that classic lub-dub sound. That whole sound, that's just 1 beat. And for an apical pulse, you must listen and count for 1 full minute, every single time. Accuracy here is everything.
So you have your measurement, but what does it mean? What happens when the numbers or the rhythm just don't seem right? Let's talk about the red flags you need to watch out for.
So if you get a heart rate over 100 in an adult who's just resting, that's called tachycardia. It's not a disease, but it's a sign that the body is working overtime for some reason. It could be anything from a fever or pain to something more serious like dehydration or even shock. And on the flip side, if the rate is below 60, we call that bradycardia. Now, in a really fit athlete, that might be normal, but it could also be caused by medications. And here's a really important one. If you find bradycardia in a child, it can be a very late, very dangerous sign that they're not getting enough oxygen. You treat that as an emergency. Spotting an abnormal pulse is only the first part of your job. What you do next, how you report and document it, is what keeps your patient safe and gets them the help they need. To make sure you're reporting good information, you have to get an accurate measurement first, so please avoid these common mistakes. Don't rush your count. Don't press so hard that you cut off the pulse you're trying to feel. And as we said before, don't use your thumb. A simple mistake here can lead to a really bad clinical decision down the line. And this brings us to a crucial point about your role as a CNA. Your job is to be an expert at gathering data. You are the eyes and ears. You observe, you measure, and you report what you find. You don't diagnose what it means. That's for the nurse or doctor. So when do you need to drop everything and tell the nurse right now? These are the big ones.
A heart rate that's way out of whack, over 120 or under 50. Any brand new irregular rhythm, a weak or thready pulse, or if the patient tells you they're feeling dizzy or having chest pain. These are absolutely not wait-and-see situations. You escalate them immediately.
And after you've reported it, your final critical step is to document. And be specific. Don't just jot down a number. Write down the rate, where you took it, like apical, and describe the rhythm and strength. This documentation is your professional legal record of what you found.
Look, this skill is truly fundamental. With every single beat you count, you are gathering critical information that protects your patients and helps guide their care. Your attention to detail, your precision, that accuracy is the most powerful and vital tool you have.